A new study from the CDC shows that the COVID-19 vaccines have reduced hospitalizations among older adults.
Plus, new research shedding light on how COVID-19 variants have evolved. KPRC2 health reporter Haley Hernandez breaking it all down this afternoon. Haley.
Yeah, obviously they've learned a lot over the past year, right? So doctors say knowing how COVID-19 variants have changed throughout the pandemic is important to understand how to fight the virus. Now, researchers at Cleveland Clinic looked at variants from the first 6 weeks of the pandemic. That's important because that time frame was chosen because therapies and treatments, they hadn't been around yet, right? So doctors discovered that the original variants were quick to mutate. They also found that as variants progressed early in the pandemic, they became less severe but more contagious. However, by knowing what they do now, they're better able to predict patient outcomes and then adjust mitigation efforts.
Each of these different strains may have a different effect on a person's severity of illness. And so trying to figure out what strains are worse than others will give us a better risk estimate as a physician, when I'm going to be taking care of these patients, what to expect, who's at higher risk than others.
And Dr. Esper encourages everyone to get vaccinated, which he says will not only help slow the spread of the virus, but stop those new variants from forming in the first place. The CDC says the Pfizer and Moderna vaccines drastically reduce the rate of hospitalization among older adults. In fact, they reduce it by 94% in anyone at least 65 years of age. Researchers looked at hospital data involving 417 adults 65 and older. They compared the odds of vaccination among those who had been tested positive for COVID-19 versus those who tested negative. They found those who were fully vaccinated with either Pfizer or Moderna were 94% less likely to be hospitalized when compared to those who were not vaccinated. The CDC says these findings are consistent with the clinical trial results for both vaccines. Guys?
So, Haley, so that basically means what they've been saying, that the vaccine is 94% effective.
Yeah, it is proving to be the case in that age group. That age group had no reservations about getting vaccinated, which also could explain why the current population that's in the hospital right now is fewer older and more younger people now who have not been vaccinated yet. Christine?
Okay, Haley, we appreciate the update. Thank you. Interesting.